Hello, everyone. Thank you very much for joining today's webinar all about K2D3-Boost. It's for the calcium metabolism in the body. My name is Enver Kelestade. I am a clinical nutritionist and a doctoral researcher at the University of Southampton, London, in the field of gut health, immunity, and metabolic disorders. As I mentioned, today we're going to speak about K2D3. So, first of all, I would like to start with calcium in the body. Calcium is a main element in building bones and teeth. Calcium plays an active role in clotting blood, regulating muscle work and nervous system, and regulation of skin, hair, and nails condition. Mainly, in the development of osteoporosis, as we age, our body is unable to regenerate bone as quickly as it used to be. And after 35 years, bone mass in women decreases by about 10% and in men by 5%. So it's like more prevalent in women. And this decrease in imperceptible, but after 50 years, it's observed in many people. With age, with an unhealthy lifestyle and unbalanced diet, the bone structure gets weakened and bone porosity develops, which causes bone pain. Many individuals take pain for like salty position or rheumatic, and in fact, these are the first signs of a decrease in bone mass or its thinning. Osteoporosis affects about 75 million people in Europe, the US, and Japan. In Europe, mortality associated with osteoporotic fractures exceeds cancer, with the exception of mortality from lung cancer. And women over 45 spend more time in the hospital for osteoporosis than for the individuals with diabetes, myocardial infarction, and breast cancer. And I would like to take a note, in Europe's population is aging, and it's been seen that by 2050, the number of osteoporotic fractures of the femoral neck is expected to increase from 500,000 to 1 million cases annually. As I mentioned, osteoporosis is a loss of bone tissue. And we can also tell easily that it's an epidemic of the 21st century. And you can see in this diagram how it progressed from the young years and then moving to the full osteoporosis gradually. I would like to take a very, very big note for vitamin D and vitamin K in preventing osteoporosis. But let's look deeper. What is the role of vitamin D and vitamin K? Vitamin D is required for proper calcium metabolism. It contributes to the absorption of calcium in the intestines and maintaining its normal level in the blood. Vitamin D3 must be taken with K2 together. As you can see in our formulation, K2 and D3 together. Vitamin K2 improves the condition of bone tissue only when the calcium transported by them interacts with vitamin D3. Without vitamin K2, calcium begins to accumulate in the lining of the blood vessels and causes calcification of the blood vessels. Vitamin K is a group of vitamins like K1, phytomenadionine, and K2 is a menaquinone. And phytomenadionine K1 is found in green plant foods and is involved in the process of blood clotting, whereas Menaquinone is found in animal products and comes in a variety of forms. There are 9 known versions of the chemical structure of menaquinone. They are numbered from MK4, before like MK13. Their effects on the body is identical, but they may differ in the degree of digestibility as well as the difficulty of isolation from food. In dietary supplements, 2 forms are generally used. It's like MK and MK7, which is absorbed better than the other forms. And here, let's look at the composition of like K2D3. So in our formulation, of course, we have vitamin D3. As I mentioned, it has a significant role in the absorption of calcium, phosphorus, immune defense of the body, formation of nervous tissue, regulation of blood pressure, and inhibition of growth of the cancer cells. K2, of course, plays a role in the calcium deposition in bones and teeth. Magnesium, calcium retention in the cells. Choline have a role in the absorption of fat-soluble vitamins. Acerola extract, it has a role in normal function of the skin, gums, capillaries, teeth, ligaments, and bones. We have bamboo extract, which enhances the synthesis of collagen fibers, keratin, and epithelial tissue, which gives elasticity and firmness to the tissues. We have zinc for maintaining good vision, healthy bones, skin, nails, and teeth. Manganese for bone formation, cartilage, and synovial formation of fluids in the joints. Copper for production of collagen and elastin, and B vitamins, which are B3, B6, and B9 in this formulation, for amino acid metabolism, nucleotide synthesis, and cell DNA repair. So it's a complex for maintaining bone health, that everything is included. Vitamin D3, also known as calciferol, it regulates the absorption of calcium and phosphorus from the small intestine and maintains the level of calcium in the blood within normal limits and promotes the mineralization of bone tissue and teeth. Vitamin D3 also provides high sensitivity to insulin, increases insulin response, and regulates glucose levels. It stimulates the production of protective immune cells, such as macrophage, reduces inflammation in the body, and prevents thrombosis and helps lower blood pressure. Vitamin D3 has a positive effect on vision, concentration, and memory. Vitamin D affects the number of spermatozoa as well as their mobility and equality, so it has a role in fertility as well. It promotes conception, preservation of pregnancy, and normal gestation of the fetus, and extremely necessary during pregnancy as it affects the formation of the immunity of the fetus and its bone tissue. It restores the body of a woman after childbirth and corrects the condition of during postmenopausal syndrome. And vitamin D largely inhibits the growth of tumor cells, as I mentioned previously, and mainly vitamin D slows down the aging process. The need, don't forget, of the vitamin D increases with the age. And here summarize some of the deficiencies associated with the vitamin D, such as periodontitis and gingivitis, asthma, diabetes, rickets, of course, osteoporosis, as I mentioned, the depression, cardiovascular diseases, pain in joints and muscles, back pain, aches, muscle weakness, and other, such as Crohn's condition. These are all known to be associated with the deficiency of vitamin D. Vitamin K2 in the form of Menaquinone 7 is involved in the metabolism of bone and connective tissue, including teeth, and is responsible for the process of blood clotting. Vitamin K2 prevents calcium deposition and slows down the process of calcification in cartilage, vessel walls, skin fibers, and trabecula of the eye, prevention of glaucoma. Vitamin K2 protects against calcification of the coronary arteries, coronary heart disease, and other diseases of the cardiovascular system. An additional effect caused by an improvement in the condition of blood vessels is a reduction in oxidative stress, as well as an improvement in brain function. Vitamin K2 also improves insulin sensitivity, has anti-inflammatory properties, and it contributes to the normalization of cholesterol metabolism, thus has a positive effect on carbohydrate and lipid metabolism. And we, scientists, have found that vitamin K2 can slow down and possibly stop the activity of cancer cells. It has already been shown to have a positive effect on cancers of the lungs, pancreas, bladder, and rectum. Here you can see that on the left-hand side, in the normal vitamin K2 levels, calcium goes to basically optimal carboxylation of matrix GLA protein. Basically, it's like an extracellular glycoprotein which prevents calcification of the soft tissue. And you can see that it goes and calcium is used to build up the bone tissue. But in the case of deficiency of vitamin K2, calcium will go, and there are like insufficient carboxylation of matrix GLA protein, basically these glycoproteins, and calcium will deposit it in blood vessels and soft tissues. And here we have, in the formulation, as I mentioned, we have Aquamin, magnesium. Magnesium is involved in controlling the exchange of calcium that enters the body and is utilized by the cell. Calcium without magnesium cannot be absorbed by the body. I would like to emphasize again, calcium without magnesium cannot be absorbed by the body. Magnesium deficiency is an indirect cause of the progression of caries, osteoporosis, and slow healing of bone fractures. The main advantage of Aquamin magnesium is that in combination with trace elements, it has high digestibility in the body, and unlike conventional magnesium oxide, and also has a 50% higher solubility in water, which all means Aquamin has magnesium, higher bioavailability. Bioperine, which includes our formulation, is a 95% extract of the substance piperine obtained from black pepper seeds. It has been found that piperine increases the bioavailability of various substances from 30 to 200, which increases their absorption in their intestine by directly acting in the intestinal epithelium without irritating it. Piperine enhances body heat production, activates blood circulation, and speeds up metabolism and promotes fat burning. Piperine normalizes insulin levels and helps with insulin resistance. Piperine has been shown to enhance the effect of additives such as ginkgo biloba, water-soluble vitamins such as B1, B2, B6, B3, folic acid, fat-soluble vitamins such as A, D, E, and K, antioxidants such as coenzyme Q10, beta-carotene, lutein, zeaxanthin, amino acids, minerals such as calcium, magnesium, iron, zinc, selenium, and curcumin and resveratrol. And in our formulation, the inclusion of bioperine will also contribute this high bioavailability, which I mentioned to the magnesium. And here, I've just summarized some of the physical disorders as a result of chronic magnesium deficiency. As I mentioned, like these are some of them are like caries, chronic fatigue, arrhythmia, diabetes, Parkinson's disease, immune diseases, sexual dysfunction, gallstones, postmenopausal syndrome, general weakness, and cardiovascular disease. Zinc in our formulation promotes the proper development of bones and cartilage. It enhances the action of vitamin D and promotes better absorption of calcium, so its deficiency leads to osteoporosis, weakening of the bones, and increasing their fragility. Manganese in this formulation is it's a microelement necessary for the formation of bone tissue, the formation of cartilage, and synovial fluid in the joints, and the synthesis of proteins, ATP molecules, which is responsible for the energy, and the regulation of cellular metabolism. Copper in our formulation, which is again a microelement included in the enzymes that control the metabolism of proteins such as collagen and elastin, which are the basis of connective tissues in the body, such as tendons, cartilage, dermis, and form a voluminous network of fibers that give strength to the connective tissue. Elastin is also used to build up connective tissue fibers that form the inner layer of blood vessels. Therefore, copper-containing preparations are often used in the treatment of fractures and torn ligaments. B vitamins, they help to eliminate the symptoms of inflammation in the vessels, joints, and restore damage in joint tissues, and the joint become more mobile. The patient needs less steroidal and anti-inflammatory drugs. Vitamin B4, which will also promote the absorption of fat-soluble vitamins. Vitamin C in the formulation take part in blood clotting, tissue regeneration, and collagen synthesis. Bamboo extract, which is a natural source of silicic acid. Silicon is an element that determines the properties of flexible structures. The connective tissue of tendons, the walls of blood vessels, and the gastrointestinal tract, endocrine glands, cartilage, synovial fluid in the joints, valves in the vein system, and cardiovascular system. It enhances the synthesis of collagen fibers, keratin, and epithelial tissue, and gives elasticity to firmness to the tissues. And Bioperine, it is a 95% extract of substances piperine obtained from black pepper seeds. Bioperine improves the bioavailability of food components by increasing their absorption in the intestine by direct action on the intestinal epithelium. K2D3, as I mentioned, it promotes proper absorption of calcium, which moves calcium to the areas of the body where it's needed, in the case such as bones and teeth, and removed from areas where it should not be, such as from the arteries and soft tissues. It reduces the risk of developing osteoporosis and strengthening bones. It helps reduce stiffness, calcification of the arteries, improves the elasticity of blood vessels, ligaments, and prevents aging. K2D3 plays an important role in protecting the cardiovascular system and the brain, promotes the activation of proteins that control cell growth, plays an important role protecting against tumor cells, and promotes muscle tone, improves immunity, and is necessary for the functioning of thyroid gland and normal blood clotting. So here are the benefits and bioinnovations of K2D3. Vitamin B3 in our formulation, as it's one of the most important ingredients in this formulation, is in liposomal form. It has a progressive form of vitamin K2, such as Menaquinone 7, which is in microencapsulated form. It has organic silicon from bamboo extract. It has a soluble Aquamin Mg, which is highly densifiable, Bioperine, which enhances absorption of ingredients, and has synergistic effect, basically, which means that one of the components of the complex will enhance the other. In K2D3, we have 4 effects in one bottle. Basically, it increases your immunity, it will reduce the risk of osteoporosis and strengthen the dental tissue, will improve the structure of hair and nails, and helps to reduce the stiffness of the arteries and improves the elasticity of blood vessels, connective tissue of the skin, and ligaments. And here I would like to show some results from the clinical studies from our individuals taking K2D3. Here on the left hand side, you can see the before the appointment, and on the right hand side, you can see that after 30 days of taking K2D3-Boost, and after 30 days, the thickness of the intima media complex was reduced from 0.500 to 0.437 millimeters. And I would like to mention about and give a little bit detail what this intima media complex is. Basically, the increased intermediate complex, or like the thicknesses, is associated or linked with the atherosclerosis, which is a buildup of plaque in arteries, which can cause heart attack, angina, or stroke. You can see that the reduction that we see after 30 days of taking K2D3 will help to prevent these conditions. And here you can see that we have results from our clinical trial. We have 2 outcomes in here. The first one is the trabecular bone index, which is labeled in blue on the left as TBI, and on the right hand side we have BMD, which refers to bone mineral density. These both outcomes are used to assess the health of bones. You can see that after 30 days, which is behind in the red columns, there is after 30 days of supplementation with K2D3, TBI, which is on the left hand side, the red column, is increased, which is associated with improved bone strength and reduced risk of fractures. And On the right side, in the black, on the red color, you can see that there is an increase in BMD as well, which is increased, as I mentioned, which associated with denser and stronger bonds, which overall they indicated better bone health and reduced risk of fracture in the individual who participated in this clinical study. K2D3 is recommended to get 3 capsules, to get 1 capsule 3 times a day with meals. It has been released in a 90 capsules in 1 bottle. I would like to take a big note in here that you can combine K2D3 with many possible products from our line. And I would like to mention why it's important to combine with K2D3 with these products. First of all, 3D matrix. When you combine K2D3 with 3D matrix, you will further support the collagen production. Antioxidant properties you will get more, which can help protect the skin from damage caused by free radicals. This may contribute to the maintaining a youthful and healthy appearance. You can combine K2D3 with ursus because the deficiency of vitamin K2 may contribute to the deterioration of kidney function, so it will further enhance the function of the ursus. You can combine with uroporine, and by combining K2D3 with uroporine, you will activate the proteins that help regulate calcium deposition in bones and prevent calcium buildup in the soft tissues. You can combine K2D3 with alpha-omega Q10 for further support of bone density and strength and have synergistic effect on the cardiovascular health. As I mentioned, you can combine with many of our products for the further effects. And we're continuing into the list by vitamin C, which is involved in collagen synthesis, which is important for maintaining the structure and strength of bones. You can combine K2D3 with Gipart. Basically, vitamin K2 has antioxidant and anti-inflammatory properties, as I mentioned, which can help protect the liver cells from damage caused by oxidative stress and inflammation. It will help to activate proteins that direct calcium to the appropriate locations, such as bones and veins, and it will prevent deposition in soft tissues, including the liver, and may influence the activity of certain liver enzymes involved in detoxification processes. So it has many roles in taking the piggy part. And you may be surprised with vitamin D3, but yes, for providing additional support and optimal absorption and utilization by the body, you can combine with other vitamin D3 as well, which is a plant-based source and is a microencapsulated. So you can ensure that all the content in milligrams you're taking of this vitamin D3 will absorb in the small intestine where it has to be absorbed and not will get degraded by the acid of the stomach. And finally, you can combine K2D3 with carbamino. Basically, because the buildup of obesity and the excess fat tissue, these all contribute to the development of inflammation, and this inflammation causes all of the chronic conditions. And this, when you combine with carbamino, and you reduces your blood sugar levels and you have like a weight loss effect. And when you combine with K2D3, you will have further anti-inflammatory effects and it will benefit you further for your cardiovascular health. And here you can see some of the links to the clinical trials and scientific articles has been used in the presentation of this webinar. I would like to thank you very much for listening to today's webinar all about K2D3. Thank you very much and wish you a nice day.